Hello friends, I am Dr. Sachin Kuber from Circumcision-clinic.in, and today I am going to discuss about very important issue of the cost of circumcision. In India, we are doing specialty circumcision surgery since last 13-14 years, and we have made available various types of circumcision in our circumcision specialty clinic in Pune city, Maharashtra, India. So basically we do 5 types of circumcision. First 3 are surgical circumcision. Those are called as basic, advanced and cosmetic. Basic involves the loose cutting of the foreskin and inner foreskin. Advanced circumcision consists of sharp cutting of inner foreskin and loose cutting of outer foreskin. And cosmetic surgery type involves cutting of sharp inner foreskin as well as tight outer foreskin. So these 3 types are the surgical circumcision types, which are done with scissors and putting on stitches. So basically the cost of circumcision is depending upon various factors like the type of disease. So normal non-diabetic person having phimosis or paraphimosis or the short frenulum or very tight foreskin or loose foreskin, depending upon the issue, the cost of circumcision is decided. Suppose if the person is self-paying and he wants to do circumcision, then the cost is different. If the person is holding any mediclaim insurance, then the cost depends upon the third party administrator, that is commonly called as TPA of that company. So whatever budget is set by that TPA company is applied for that particular patient depending upon his limit of the cashless mediclaim insurance. So the few cases who have eligibility for mediclaim insurance and those patients who are eligible for circumcision under that scheme, the cost is determined by insurance companies. Remaining self-paying patients who want to do circumcision surgery, the cost depends upon the type of disease. That is, if the BXO is there, if phimosis is there, paraphimosis, various conditions are there. After that, the type of circumcision that a patient particularly wants. So the basic range of circumcision starts from basic circumcision. The cost is very less for basic circumcision because the skin is loosely cut at the inner foreskin and outer foreskin. The stitches which are put there depends upon, say, we can use absorbable thread which is of basic quality available in the market. That reduces the cost of circumcision. Number 2, when we consider advanced circumcision, then what we do is we cut sharply the inner foreskin and loose outer foreskin. This also involves putting on stitches, and the choice of the stitch material makes a difference in the cost of the surgery. So if the expensive thread is purchased for the surgery, then the cost is high, and the basic threads are taken, then the cost is less. Now when we consider the cosmetic circumcision, the circumcision is done with the precision materials which are used for putting stitches, as well as in some cases the glue which is surgical glue is also used. So that adds up to the cost of the circumcision. Also the people who want a local anesthesia and a general anesthesia, this also puts the effect of cost changes on the overall cost of the circumcision. So whenever you take a local anesthesia, the cost remains lower side. Whenever you take a general anesthesia, then the cost goes up because the cost of general anesthesia is itself very high. Now when we are considering any kid who is up to 10 years of age who cannot take local anesthesia, then the patient who is below 10 years of age requires a general anesthesia, and that general anesthesia costs more for the circumcision. That's why the cost of circumcision for the patients below the age of 10 is usually higher, because we have to use special techniques, as well as we have to use special anesthesia, that is a general anesthesia, for this circumcision procedure. Now, when a patient is given general anesthesia, he has to stay in the hospital for at least 6 to 7 hours, and maybe in some cases 8 to 10 hours. So when the patient is staying 8 to 10 hours, the cost of the room charges is also adding into the cost of circumcision. That's why whenever there is a general anesthesia and the stay is around 8 to 10 hours or maximum 12 hours, the stay cost is also added into that anesthesia, into that circumcision cost. That's why it becomes more. Then there are few medical conditions like diabetes or high blood pressure or ischemic heart disease, asthma, so or alcoholic diseases. So in those diseases, when we want to do circumcision, then the cost increases around 10 to 25%, because already the patients who are suffering from these diseases already have other elements also. Maybe there are bleeding disorders, maybe they are taking aspirin tablets. That's why the chances of bleeding are high. So we have to check their blood sugar, blood pressure many times during the procedure, and that's why the cost also goes up for the circumcision. So in all, it can be said that 10 to 25% increase in the cost of the normal circumcision is expected in cases of bleeding disorders, diabetes, blood pressure, ischemic heart disease, asthma, epilepsy, like that. So special precaution and special care has to be taken during and before surgery. Also after surgery, few medications have to be given. That's why the cost of circumcision may go up by 10 to 25%. Next point is the non-surgical circumcision, that comes under the cosmetic type of circumcision. Usually these cosmetic procedures are not covered under any Mediclaim insurance or cashless Mediclaim insurance or reimbursement Mediclaim insurance. So this entirely depends upon the mind of the patient, that he wants a cosmetic circumcision, and it is a non-surgical circumcision, and usually it is done under local anesthesia for adult patients. So the patients below the age of 10 who want to undergo the circumcision without stitches, that is a stitchless circumcision, or we can call it as non-surgical circumcision, that requires hospitalization around 6 to 9 hours or 10 to 12 hours depending upon the patient's medical condition. So the cost of general anesthesia, cost of stay in the hospital for 10 to 12 hours adds up to the cost of anesthesia in cases of the non-surgical circumcision. Now the patients who want to do non-surgical circumcision, that comes with two variants, that is number one is Alice clamp and number two is ZSR circumcision. In previous part I have told you about the cost of circumcision for surgical circumcisions. There we don't use any device, but in case of non-surgical circumcision we use these two devices, that is Alice clamp and ZSR, and the cost of these devices also adds up to the circumcision. So non-surgical circumcision tend to be having higher cost than the surgical circumcision, but it comes with added benefits, like it is a bloodless, painless and scarless and stitchless circumcision that you get. Also the results of the device circumcision, that is non-surgical circumcisions, are way superior than these surgical circumcision. So the overall cost increases in adult patients as well as in the pediatric age group patients below age of 10. So in the patients below the age of 10, the cost of general anesthesia plus hospital stay is increased. In case of adult circumcision, if they are taking local anesthesia, the cost is low for anesthesia, and those patients can be sent home or discharged in 1 hour or 1.5 hours. That's why the cost of adult circumcision is less in non-surgical circumcision, and in surgical circumcision it is high. So this is the main idea behind deciding the cost of circumcision. So patients who want to do circumcision can decide upon what type of anesthesia they want. They want general anesthesia or local anesthesia. According to that, the cost is decided. Then the cost of device for non-surgical circumcision, that is the cost of Alice clamp and cost of ZSR device, is considered. Usually the cost of Alice clamp device is less depending upon the dollar exchange rate, and the cost of ZSR is somewhat higher side. Now it also depends on the exchange rates of dollars. So as it is as both are imported devices, the cost changes from time to time. So we cannot give any fixed cost to any patient depending upon the changing nature of dollar exchange rates, US dollar exchange rates. So all these things like the age of the patient, the medical condition of the patient, the cost of the device according to the dollar exchange rate, and associated medical conditions like diabetes, blood pressure, asthma, bleeding disorders, epilepsy, ischemic heart disease. These diseases also add up to the cost because they need special care and special attention for the patients suffering from these diseases. So in case of non-surgical circumcision also, if those patients who are having these medical diseases may add up to 10 to 25% depending upon the person to person. So overall cost consideration is depending upon these factors. So patients, when they come for us to consultation, we tell them the exact idea behind the estimation cost. Many times people ask us on the phone or WhatsApp or email that what is the cost of say ZSR circumcision or what is the cost of Alice clamp circumcision. We cannot tell them exactly because the dollar exchange rate is always changing, fluctuating, as well as when we are contacted by any medium, we don't know the medical condition unless we check up. So exact cost estimation cannot be given on phone, email or WhatsApp. What we can do is we can give you a range of estimated cost, and according to that you can decide. Like first the patient needs to decide whether he wants to do a surgical circumcision or non-surgical circumcision. Then what is the budget of a patient? If he has very low budget, then he can go for basic circumcision, that is a surgical circumcision. The cost is very less for this type of circumcision. If the patient just wants the best cosmetic look, he wants the stitchless circumcision, bloodless circumcision, scarless circumcision and stitchless circumcision, then he can think of ZSR circumcision, which is the topmost in our category. The cost is more high for this ZSR circumcision. So number one, basic circumcision is the lowest in the category and ZSR circumcision is highest in the category. So according to the categories, the cost goes up or comes down. Like basic circumcision at the bottom, then advanced circumcision, then cosmetic circumcision, then Alice clamp circumcision, and then ZSR circumcision. So from basic to ZSR, these cost changes according to various factors just told to you in this video. So whenever you decide, either you decide your budget, that you want the least budget for any surgery like basic circumcision, or you have to decide the cosmetic circumcision. What is your aim? Do you want a very smooth fine scar? You don't want a scar in the circumcision, you don't want stitches, you don't want pain, like that. So then you decide whether to have Alice clamp or ZSR. These two options give equivalent results, but only the method is different. That's why you get similar results with the Alice clamp and ZSR methods. So these are the factors which are told to you, and those factors decide what is the exact cost of circumcision that ultimately at the time patient has to pay. Because whenever you decide and make an inquiry about any particular circumcision, and Suppose if you come after 1 month or 2 months, 3 months for the surgery, then the cost may change, because the exchange dollar rate, the cost of the device is always changing. Like that, these factors put an big impact on the cost of circumcision. That's why you have to particularly decide what exactly category you want. According to that, you can choose the particular type of surgery. If your aim is clear, or the things which you want are clear in your mind, then it is very easy for you to choose any particular type of circumcision. Because what we have done is, we have made available different types of circumcision according to the budget, according to the cosmetic appeal, as well as according to the results, or what is the aim of the patient. According to that, we have designed it. So whenever you choose, you put these things into your mind, and what is your goal, what is your budget, what are your specific requirements. According to that, you can choose a particular circumcision, and that will be suitable for you. So thank you guys for listening patiently to my points, and please like and share this video. Don't forget to subscribe to our channel, and you can contact us through WhatsApp or our website or email. So the links or the details are given in our description section of this video, and please do not forget to subscribe. Thank you for patient hearing.